Welcome, everybody, to the Bainbridge Island Senior Community Center, Something to Talk About. My name is Katie Oj, and I am the Community Resource Navigator with the center. And it is my pleasure to have joining us today Dana Gargas, who is our long-term care ombudsman for the county. I know she's got a ton of great information to share with us. So I'm going to go ahead and turn the mic over to Dana. And then again, please feel free to ask questions as we go along. All right, Dana, welcome. Thanks so much for joining us.
Thank you for having me. It's always my joy to be able to do community education. It's a passion of mine. That sort of gives, I'll tell you a little bit about myself and why this is my passion. I moved to Bainbridge Island in 1989, and I was told that you're really not a local until you've been here for 30 years. So I'm a local Bainbridge Islander. Some of you who've been around for a while might recognize me. Once upon a time, I was the ice cream lady. I had a cream of the crop ice cream. So at the pavilion or at Bainbridge and Bloom, we would sell ice cream. So you might recognize me from there. I am a social worker by education. I got my degree in social work back in the 80s, and I worked in California, and then my family moved up here in 1989, and I have lived on Bainbridge Island ever since. I worked for DSHS for a while and got really frustrated around 2000 and 2004. My therapy was opening the ice cream business, which was wonderful. It was lovely to be able to serve ice cream to children who ordered by the color, coming off of the stress of the welfare office. When we had our economic downturn in 2007, 2008, I needed to get a job because running this ice cream business was a passion, but it really wasn't much of a moneymaker for me personally. So I went back into social work and got hired at the Division of Aging. Now, in the interim of this, I should tell you that in 2006, my mother died of breast cancer after a 25-year battle. And I got the phone call from my family. My mother was in Los Angeles, and I went down there, and it was the hardest, most honorable thing I've ever done was to help my mother die. And I was totally ill-prepared for it. I was a social worker. I graduated from UC Berkeley. I had worked in social work for years and was not prepared. I can tell you that my mother's doctors were not talking to her about end of life. This is a woman who had had cancer treatment for 25 years, and they were still trying to hold out hope, and they were still trying to treat her. My mother had hospice for less than 24 hours before she died. And that was really a sad statement, because those are benefits that she earned and she had a right to, and they would have made the end of her life so much more comfortable. So what happened was I did this totally ill-prepared. I assisted my mother in her death. I was in this emotional fog for about a year, came out of the fog and thought, I need a job. And I went to the Division of Aging. In Kitsap County, our area agency on aging is the Kitsap County Division of Aging and Long-Term Care. Its home office is in Port Orchard. So I got hired by them. This was the first time I'd worked in a social service position where it was focused on the seniors, primarily on the seniors. I had done all kinds of other levels of social work, but never exclusively with the seniors. And I started to learn about all the programs that are available through the Older Americans Act. The programs that all of our federal tax dollars have paid for, that are there for free and I started getting really angry. There was so many support programs that could have been available to my mother and to my family, and we did it alone. Her doctors didn't connect us. Nobody connected us. And I was ashamed of what I didn't know. And it's been my passion to help educate as many people as I can to the benefits they have paid for. In your working life, you have paid for all of these benefits. You have elected officials who agreed with you that these are important benefits for you to have in your seniority. And most people don't know how to access them or that they actually are there. So I am here to champion all of that. The way that you connect with a lot of these services, your money through federal taxes goes to the other Washington on the East Coast, and it gets disseminated through aging services, through the Older Americans Act out of the federal government, and it gets sent to area agencies on aging. There's over 600 of them across the United States. Frequently, we will find them as county specific. In the state of Washington, there are 13 area agencies on aging based on population. Some are one county, some are multiple counties. Kitsap County is one of the 13 area agencies on aging. And, you know, it's a reminder to people on Bainbridge Island, you are not part of King County. You are part of Kitsap County, and you have to go to Port Orchard to get the services you're entitled to. You got to get off the rock and drive across the bridge. Even though I guess as of today, they're starting bridge work and we don't want to drive across the bridge today, but you got to get across the bridge to get there. So a bit about what are you going to find? What is your money paid for? What's waiting for you in Port Orchard? One of the great services is senior information and assistance. The magic phone number, the easiest phone number for you to have at your ready is just dial 211. If you dial 211, you will get a person who can answer questions and give you phone numbers for almost anything else. I don't know if you were aware of that 211 service that our phone system is a part of. Any phone anywhere in Kitsap County, free phone call 211. The actual phone number for senior information and assistance in Port Orchard is 360-337-5700. Your tax dollars have paid for there to be a human being to answer your questions 5 days a week. In the time of COVID, the office isn't open. There are some people who are working in the office and others who are working from home. So your call, you might have a message taken and then get called back. But there are intake specialists every day answering phone calls and talking to people across the county. If they don't know the answer to your questions, they know people who can get those answers. Usually, not only do they have the answers to your questions, but they have pieces of literature related to the question that you're asking, and they will put those in the mail to you. Now, this is senior information and assistance. So it's technically about issues around folks who are 60 years old and older. If you have questions about the AARP tax preparation, tax season is upon us. Where can you go to get free tax preparation? They'll give you the schedule of where they are and how to get involved with them. I'm not sure how they're doing it in the time of COVID, but I bet people there know. The senior center, there you go, Reed, thank you very much. These are the types of questions. If you have questions about how to get your property tax exemption because you're a senior, there's all sorts of things that they can do for you. Through the Older Americans Act, your money pays for things like legal services. There is a limited amount of free legal services for seniors. The contract through the Division of Aging and Long-Term Care is for those services to be provided. You're referred to the Clear Senior Program, Clear Legal Services, and they can do things like guardianship questions, powers of attorney issues. There is some free, some low-income help through legal services. There's mental health services in a collaboration with Kitsap Mental Health. In Kitsap County, we have a dementia specialist, which not everybody knows about. Denise Hughes is our dementia specialist. You can call the phone number for senior information and assistance and ask for her. Anybody in Kitsap County, no matter where you live, whether you're in your private home or if you are in a long-term care facility, if somebody has dementia and their behaviors are a threat to the stability of their living situation, that, you know, it's great to have you read. If I can just have you in my hip pocket all the time, thank you for that support. So if you've got somebody who's got dementia and their behaviors are putting their living situation at risk, Denise Hughes, who is retired from Kitsap Mental Health, she was the supervisor of older adult services at Kitsap Mental Health for a dozen years or more. She is a nurse. She has lots of experience. She will come and do a one-time consultation, look at medications, look at the environment, really be able to try to see what can be done to preserve that relationship. So it might be that living in long-term care is at risk, and it might be taking care of a loved one at home. You might be at that edge where you're thinking about, is it time for placement, but you don't want placement. A consultation with Denise might be able to be of benefit. These services, you know, I'm reluctant when I hear myself say they're free of charge, because they aren't. You have paid for them in your tax dollars already. These are services that are available to you because you have already put them in place. But in none of the services that you get through the Division of Aging will you ever be asked to pay anything additional for. This is your tax dollars at work. Caregiver support. The Caregiver Support Center is a part of the Division of Aging and Long-Term Care. It is absolutely known that taking care of folks at home with their loving, untrained family caregiver is really the backbone of our senior caregiving situation. The majority of people are cared for at home by loved ones. Frequently, the situation gets a little bit more than loved ones can handle. And the Caregiver Support Center is there to help, whether it's education, whether it's counseling, whether it's just having Meals on Wheels brought in, whether it's a little bit of extra money to buy that one piece of assistive equipment that would make bath time so much easier. Their situation is different for everybody, but the government understands that we get the most bang for our buck to support family caregivers and keep those situations going. The Caregiver Support Center is in a couple different places across the county. Again, that main phone number is the way to connect with them. They've got an office in Silverdale. They are now also have an office out of the Helpline Fish Line in Paulsbo. I'm trying to think what other hot topics. They have services for kinship support, grandparents who are taking care of their grandchildren, and that multi-generational caregiving situation, there is support in that situation. The home delivered meal program in Kitsap County is sponsored through the Division of Aging and Long-Term Care. There's the MAC, there's the TSOA. Also, those who are on Medicaid and the state of Washington is paying for caregivers to come into their home to help support them at home, the case managers for that program are also in the Office of Aging and Long-Term Care in Port Orchard. There's a lot going on there. So I implore you to know that turn your sights towards Port Orchard, not to Seattle, when you run into troubles and you need help. We are Kitsap County. So this is my jumping off point to go talk about the Ombudsman's office and what I do, unless anybody has any other questions about the Division of Aging and what's going on there.
So I know I frequently call Kitsap Aging and Long-Term Care Services. I find them to be so incredibly helpful to answer questions, to help get guidance, to help get resources and information. I am available at the Senior Center to talk to folks if somebody forgets the phone number or wants clarification on any of their services. I will happily make sure that you get in touch with these folks. They do incredible work. And I also just wanted to point out, I know we've had some of the folks from the Caregiver Support Center come and speak with us. And one thing that I really love that they pointed out was how they say that this is not a one-size-fits-all center. This is really meant to gear towards your specific needs, your loved one's specific needs. They're really looking to work, one-on-one with you to figure out what it is that would best work to support you and your loved ones. So I know sometimes it's kind of intimidating, feeling like you're walking into a program and you're just, they're just going to tell you yes or no, or this is what to do. But I think their intent really is to work with individuals and figure out what's best.
I think that's the intent of a lot of the programs that you will find at the Division of Aging. So I can tell you, if any of you have been involved with the home delivered meals, there's the meals, the congregate meals that were happening at the Senior Center. But if you get those home delivered meals, everybody who signs on to that program gets an in-person assessment. I'll go in the day of COVID, it's probably over the telephone. But what happens, and once upon a time, I actually did that job of home delivered meals assessments. You get your foot in the door. It's the opportunity for the county to get their foot in the door and see if there's any other way we can help you. If there's any other programs that would assist in your situation that you don't even know about. Anytime you connect with Senior INA or Caregiver Support or the home delivered meal, they are looking for what they can do to help you in all kinds of facets beyond even what your original request was. These are your programs, and we are trying to serve you. So I will move on to me, because my office is also in Port Orchard, even though right now my office is a camper sitting in my driveway here on Bainbridge Island. So I started with Senior INA in 2009, and I was the assist specialist, and I was going out with home delivered meal appointments and other things. And in 2011, the long-term care ombudsman approached me and said, I'm retiring and you're going to apply for my job, right? So I applied for the job, not knowing a whole lot about what it was. The short answer about what is a long-term care ombudsman is that I am an advocate for the rights of residents who live in the nursing homes, the assisted livings, and the adult family homes across Kitsap County. When I first signed on, Sheila asked about another type of ombudsman. You will know the name ombudsman. This is Kitsap County. You probably know it from the Navy. There's Navy ombudsman. There's educational ombudsman. You might have heard the name. Ideally, it's an advocate to help people through governmental systems. The long-term care ombudsman is a little bit different. In theory, ombudsmen we're do-gooders and we just help guide people. There is a body of federal law that gives residents a certain rights. Residents who live in licensed long-term care, the federal law specifically addresses nursing homes, and part of that federal law is that there is an ombudsman. An ombudsman's work cannot be impeded, and ombudsmen have the right to have contact with the resident 24/7, and we have the rights to get resident records, and we are not bound by HIPAA, and we are not bound by mandatory reporting. There's these incredible, unique body of law that's just for long-term care ombudsmen. And all of that boils down to, it's about us being able to have that trust relationship, and so that we can advocate to the fullest for somebody who is living in long-term care. In Kitsap, in the state of Washington, there is one ombudsman, one long-term care ombudsman, and her name is Patricia Hunter. Patricia Hunter used to work through the Alzheimer's Association, so some people know her from her work with them. She's been the state long-term care ombudsman since 2011. Just like our area agencies on aging, there are 13 regions for the ombudsman program, and every region has a regional ombudsman. For Kitsap County, I am the regional ombudsman. I represent all of Kitsap County for the long-term care ombudsman program. The program in the state of Washington is run primarily with volunteers. I have a team of volunteers. Right now, I have only about a dozen volunteers. I like to have closer to 20, but with COVID, there's been some attrition. The volunteers and I, hopefully, actually by next month, our goal is to start getting back into long-term care facilities by March. Before COVID, we go into facilities. A volunteer basically adopts a facility and visits that facility on a regular basis, contributing about 5 hours a week to being an ombudsman. The ombudsman gets to know the residents, gets to know the staff, the systems, so that ombudsmen are there. If there's an issue as simple as, I lost my favorite pink sweater in the laundry, I haven't seen it, an ombudsman can help talk to the go-to people in the laundry, help figure out where the sweater is, if it got put in somebody else's room. If it's a dementia care facility, it might be that some other resident has borrowed the sweater and finding it and getting it back to its rightful owner. But sometimes it's very serious. Sometimes the rent check bounced and the granddaughter's driving a new car. Sometimes it's that I had a conversation today with somebody who's concerned that their mother is getting urinary tract infections because she's not being offered enough water to drink and that she's dehydrated. And in the time of COVID, when loved ones can't get into those buildings, it's very frustrating. Are people getting socialized? Are they getting fed? Are they getting toileted? Are they sitting in their own filth so that they're developing sores? There's a huge array of things that an ombudsman can help with. As the subject matter expert in long-term care for Kitsap County, I'm also the person that your tax dollars have provided you with, that you can call and say, I've been caring for my loved one at home. It's beyond my capacity now. What do I do? How do I shop for long-term care? What am I looking for? Can you give me some guidance on the best facilities? And how do I pay for it? What do I need to know? What do I have to get together to figure out how do I pay for long-term care? Any question? I keep on looking at this sea of little red dots, thinking, oh, there's a red dot's going to turn to green. And does anybody have a question?
Dana, I had a question. So when you're talking about, you know, the volunteers and folks that are actually going in and forming these relationships, what's the best? Is it best to reach out directly to you to then kind of find out, depending on which long-term care facility somebody's in, or can they simply ask the long-term care facility, you know, I would like to get connected, or who do I speak with? What does that process look like?
So I will. So back in the day, I'm just going to see in my little home office if I have one. I know I have something here. So in every facility, if you were physically in the facility, if I remove this, that's sort of funky, and I don't know if you can see it. By law, in every facility, there's a yellow poster. It's on the wall in every licensed long-term care facility. And the yellow poster says, notice, concerned about abuse, neglect, or violation of residents' rights. There's the first phone number on the yellow poster are the state investigators. And so this is calling Olympia. The bottom number on the yellow poster is the local state ombudsman's office. So my phone number is on the yellow poster in every facility. That being said, you calling me is the way to go. The phone number you would find on the yellow poster, the phone number to call me is just two numbers different from our senior INA phone number. It's 360-337-5714. And that's my direct line. And given COVID and that I'm not in the office very much, the best way to communicate with me is email. And my email address is dgargus, GARGUS, at co.kitsap.wa.us. Do I need to repeat that? There you go.
That's been added to the chat. And again, I have Dana's information on file as well. So if you realize at any point that you're forgetting which direction to head in, you can always contact the center and I'll make sure that you get that information.
So this conversation will ultimately lead down the road where I'm going to tell you we're a volunteer organization and I need volunteers, and I'd have very few volunteers from Bainbridge Island. So what happens, because to answer the question more fully, because we're a volunteer organization, your personal contact information is never out there in the public. My contact information is your contact information. So that if you had a loved one in a facility that had an ombudsman, the phone number that you think you're contacting the volunteer ombudsman is going to be the phone number for my office. And I will tell the ombudsman that you are trying to connect with them. And I will be that intermediary, because volunteers should not have to put their personal information out there to do the job. Any other questions? So we can talk about I see a hand up.
Hi. I don't know if you can answer this question, if it's the same, you know, but I wondered if there's any alternative to long-term care insurance, which I've been paying for years, and it's getting, you know, pretty expensive, especially with lower income.
Yeah, you know, the long-term care insurance is difficult. Now, we're Washington State. We're the first state in the country to actually have a long-term care insurance public program now, but that's not going to, we're just going to start paying into it next year. Long-term care insurance, I have seen it work wonders and save the financial hiney of a number of people. but it's a gamble. And I've also seen it not work. I've seen a situation where somebody needed to start receiving care in the home, and they went to the long-term care insurance to try to get it to be paid for. And the long-term care insurance said that they work with X, Y, and Z home care agencies, but none of those agencies worked in Kitsap County. So the long-term care insurance was useless. You've got to read the fine print and ask yourself, what is the likelihood you will need long-term care? Long-term care is based upon evaluating your activities of daily living. So your dressing, your bathing, your eating, your toileting, and do you need assistance with those?
Yes, but that's the question. Of course, we don't know until we need it or don't need it. I mean,
well, so there's those who might have a family history of debilitating diseases where they can assume that would be the case. And others who, that's the gamble, and it's tough. And you've invested a lot of money probably over the years maintaining that policy.
Exactly. So you mentioned earlier that the state of Washington is now starting a long-term care.
Yes, there is all workers in the state of Washington will be paying into a long-term care policy starting next year. It's certainly going to be more, it's not going to probably be the benefit package that yours has, but it's the beginning, and we're the first state in the union to do that.
That's wonderful. That's great for our kids.
Yes.
Here in Washington.
Because when it comes to this, paying for long-term care is, a big deal. Most people don't understand that Medicare, for the most part, doesn't pay for it.
Right.
And that most people have to privately pay for long-term care. And on Bainbridge Island, there's very little options for those who cannot afford to privately pay. Yeah. People who are low or moderate income probably are going to have to leave Bainbridge Island in order to be in long-term care. Yeah. And if this is your home and this is where all your supports are, that's a really difficult pill to swallow.
Yeah. Thank you.
Any other questions?
And Dana, I just like to point out too for folks, now this isn't specific to long-term care facilities, but obviously the cost of living really adds up. There's a lot of unexpected costs that we face. I know Helpline House is a wonderful resource, and also contacting Kitsap Aging and Long-Term Care Services. I always tell folks, it never hurts to just look into whether you qualify for different programs. We talked about the property tax. There's some resources there. There's all sorts of resources around food. I know Dana mentioned the TSOA program. There's the COPES program connected with Medicaid. I know everybody's individual circumstances are all going to be different, but I always encourage folks to at least just ask, look into what programs are available. You never know when you may qualify for something that can hopefully take some of the financial burden off as well. And I just saw that Reed raised his hand.
Yes, I'm wondering, when you say just ask, does that mean maybe call you, or does it mean call Senior Information and Assistance? Are either of those good routes?
Yes. Thanks for clarifying, Reed. Yes, people are welcome to contact me. I don't specifically work with programs like Medicaid and looking into COPES, but if you're unsure or you're interested, we can talk through some ideas. And then again, we can kind of figure out if Helpline is a good route, if working with the county is a good route, and it may be both, but absolutely. So you can either contact them directly or again, contact me, and we can kind of talk through further where some different options may be.
Any other questions? So I don't know how long you want me to go. I can talk a bit about residents' rights if you would like, or so one of the frustrations I think that people, people who have loved ones that they place in long-term care, all of a sudden, these folks who might have limited capacity actually end up with a lot of rights, and it gets to be somewhat frustrating to understand that. If your loved one is in long-term care and they're offered a bath and they say, no, I don't want a bath, they're not going to get one. If they say, I don't want to take my pills today, they're not going to take them. They have a right to refuse medical treatment, to refuse bathing, to refuse food. They have a right, if you are their power of attorney and you do something that pisses them off and they say, I don't want to talk to my wife ever again, they have a right to stop the phone calls. They can say, they don't want you to visit, they don't want to talk with you, and that will happen. They call the shots. Even if they have less capacity than you think they should be able to do these things, this is part of what that residence rights law entails.
Dana?
Yes.
If your loved one is in a care facility and they decide not to take food, drugs, or get bathed, does the facility call the person, the custodial type home person, to let them know what's going on?
Ideally, yeah. So if you are a power of attorney, and especially if we're talking about, let's say, dementia care, where you are helping to make the decisions for somebody, absolutely, they should be calling you. When there is a change in circumstance, they should be calling you and letting you know. Ideally, they should be redirecting. And instead of coming in and saying, do you want your bath today, Mr. Smith? They should be saying, your bath is ready, let's go.
Right, right. Yeah.
You know?
Yes, exactly. So, well, thank you for that. I had experience with my in-laws. Both of them ended up with dementia and Parkinson's, and I remember the care facility they ended up in, and they did not contact us. That was in California, probably 25 years ago. So it was the
law says that if there is a change in circumstances, you must be notified.
Okay. Well, thank you.
Yeah, you're very welcome. When I give talks to the the classes for the nursing aid program at Olympic College, and when I give talks there, I'm frequently told that I can't leave until we talk about, what do we talk about? Smoking, chocolate cake, and sex. And so those are always the highlights. So to let you know that residents have a right to smoke. Now, if it's a non-smoking facility, so on Bainbridge Island, all of the facilities are non-smoking, so that's really not an issue. But there are some facilities that are smoking facilities still. And even though people are dying of COPD, they have a right to choose to kill themselves with tobacco. And they have a right to be supported so that they can have a smoking apron put on them and help get their cigarette lit and all of that. They have a right to that. So just like diabetics have a right to kill themselves with chocolate cake if that's what they choose. And that's the residents' rights laws. Certainly, they can be educated about this is not a good choice and we have some alternatives. But if they want to eat chocolate cake and they're a brittle diabetic, the director of nursing better have some insulin on hand and know that they've got the right to do it. Another disturbing thing for family members is the sexuality piece. Just because somebody does not have capacity to make their own medical decisions doesn't mean they don't have the capacity to be able to consent to sexual intimacy. And that may or may not be with their lawfully wed partner. And that's their right. Everybody needs to be safe. And nobody can be victimized in a sexual encounter. But if people are capable of understanding their actions and consenting to them, they're not going to be stopped. So you sometimes get pairings in a dementia care facility when people are legally married to somebody else outside. Any other questions?
Yes, I had a question.
Yes.
So you mentioned about non-smoking facilities. So that's a situation where when you move in, there are restrictions that you agree to when you move in. So what are those kinds of limitations that someone might want to think about? This is very evident to me right now because a lot of assisted living and long-term care and memory care places are putting restrictions on the movement in and out of those facilities by people who live there right now. Where do the patient rights or the resident rights and the agreements that you make going in, hit?
So thank you for that. In the time of COVID, a lot of this we're just, flying by the seat of our pants here. I mean, it changes regularly. But if you have loved ones in long-term care, there's a couple things that you really need to know. Nobody in long-term care is a prisoner. Nobody. You cannot be a prisoner in long-term care. They have a right to leave the long-term care facility and go out into the community, whether that means to go to a doctor's appointment or to visit you at your house or to go down to the pub if they were open and meet people there. The deal is that every individual has the right to have their community visitation assessed independently. There is a form, a guide, as you will, for the State Department of Health that will rate the risk of that activity. If the activity is viewed as a higher risk activity, that facility very well may ask upon the return that that resident isolate and self-quarantine for 10 or 14 days if they've been engaged in risky behavior, because they do want to keep their community safe, and that is reasonable. Holding somebody hostage inside the facility is not reasonable. When it comes to visitors from the outside coming in, the governor's proclamations about stopping the visitation always had some compassionate care exceptions in place. Originally, it was written that it was end of life. And so people who got onto hospice sort of had this carte blanche of visitors because they were end of life. It's been tightened up, and now it is actively dying. There is visitation allowed when somebody is in the state of active death. But the other piece of compassionate visitation is the essential support person. And the buzzword here that you need to learn about is psychosocial decline. If somebody is exhibiting psychosocial decline, weight loss, behavior disturbances, if they're showing psychosocial decline as a result of their isolation, and they cannot engage in video chats or window visits, then the law allows for a single individual essential support person to be identified. The resident identifies who that person is, not the facility, and that person is entitled to visit once a day. They have to wear proper PPE, they have to go through screenings and all of that, but they can't be denied entrance and visitation. Now, some facilities are just starting to loosen up about this. What I can do, what an ombudsman can do, is help educate you in the law, help educate the facility in the law, and get this types of visitation going. Because nobody should be a prisoner and nobody should wither away. We know this, when this is all said and done, the statistics are horrific. I think 60% of our deaths have been in the long-term care facilities already, and that's people who've died of COVID. We're not even accounting for all of the other deaths that are COVID related, but are based on psychosocial decline. Isolation has been killing people. We know that this is happening.
Thank you for that, Dana. I know that's something that anybody who is either living in a long-term care facility or has a loved one in a long-term care facility, it's obviously been on all of our minds. But to, I think, hear it in that way, it's really, yeah. I think it's going to resonate with a lot of us. So thank you. Any other questions for Dana? And sorry, just as a reminder, if you're calling in on a phone, to unmute yourself, you're going to hit *6. And we'll just give maybe 1 or 2 more moments here, just in case anybody had another question.
Dana, I do have another question. I was told many years ago, because we were considering long-term care insurance, by the insurance person that it really was not that great. That, you know, there was a lot of areas where you had it, but certain facilities you wanted would not even take it. We did not get it. And hopefully we'll have, if we do have to go into long-term, hopefully we'll have enough money to get us through it. We've saved up. But do you have any opinion about long-term insurance?
You know, I don't, you know, if you've got, I've seen it go multiple ways. I want you to know that if you've got questions about your long-term care insurance or a specific policy, it is regulated by the Office of the Insurance Commissioner, and talk to them. It's a difficult, you know, I don't work for the industry. I've seen people spend a lot of money and not be able to utilize it.
Yeah, and Mike Crydell is great, our state insurance commissioner. Yes. I think. Yeah. So, yeah, it'd be nice if there were some kind of law or something that would say, "Gee, you got this insurance. You know, these facilities should be obligated to use it." But
read the fine print.
Right. So,
every policy is different. They are not created equal. So that, you know, you want to make sure that whatever policy you might be buying into is supported by the facilities in our area.
Yeah. Good advice. Thank you, Dana.
Great. Any other questions for Dana?
Dana, this is Rita Riley. I just wanted to say thank you for giving us all this information. And if we want to volunteer, we just email you.
Yes, please. I've got 3 people right now who are in the wings wanting to get certified to volunteer for my program. And to be a volunteer ombudsman, there's 4 days of training. And we're trying to, you know, that can easily be done over Zoom. The idea of getting into facilities, and we're still sort of in a gray area trying to figure it out, but I would welcome you. It's a big ask up front for 4 days of training, but then it's a 5-hour-a-week commitment, basically, once you're trained. I would love to have people on board. The information in the training is very much like what I've been talking about today. This is good basic information for anybody who is aging or helping somebody age. It's great information to have.
Thank you very much.
Mm-hmm.
Great question, Rita. Thanks for mentioning that. And Dana, for folks who are volunteering, are those 5 hours a week? Are those flexible? Are they?
It's very flexible. So right now during COVID, we've actually been meeting once a week. We've been having a Zoom meeting. Traditionally, we only had a meeting once a month. And so the only requirement was that you are at the monthly meeting, but that was it. And then the rest of the time is your schedule to make. Ombudsman normally visit during normal business hours, but it could be weekends. Frankly, usually it's between 8 a.m. and 8 p.m. Any time is fair game, any day of the week, and you make the schedule that fits you. So it's very easy to be done. It's a great network of people. There's just lots of good information always available to learn through the program. So anybody who is interested, please, I invite you to get in touch with me. Let's talk.
Perfect. A nice plug for a really great volunteer opportunity, something that's very needed. I'm sure we can all appreciate the work that you do, Dana, and that all the volunteers do. So thank you. And if there's no further questions, I'm going to go ahead and wrap up here and just thank you again, Dana, so much for being here. Thank you for bringing this great information. Again, just really emphasize to everyone, please reach out if you guys have questions. If you just want to learn more about the whole program, the system in general, senior information and assistance. Again, you can always contact us at the center if you've lost the phone number or just trying to figure out who to reach out to again. But thank you, Dana, so much.